Bismillahirrahmanirrahim. So this is first of all process or steps of inflammation. So what is it? There are 5 R's, as I said in my previous video. Is that there are 5 R's, which is recognition of the injurious agent. First of all, the cells or the body has to know who is the infectious agent or injurious agent that is causing damage to the body. Then recruitment of leukocytes and plasma proteins, that is leukocytes like neutrophil, macrophage, monocyte no? Neutrophil, macrophage, complement system, interference. uh, they are recruited in that particular site. They come there and exert their actions upon the injurious agent, upon the cells of the damaged tissues, and then removal of the stimulus for inflammation. That is the thing or the thing or the infection, sorry, in this case this is the injurious agent that is causing the stimulation of the inflammation process. It should be removed by phagocytic cells, by phagocytosis, like, and the dead cells should, and the microbes with the phagocytic cells ingest them and destroy microbes and dead cells, and eventually it removes the injurious agent from the body. Then regulation of the response, it's a kind of a control of that response, which is a termination. Then a kind of control is that the body should be known, we should know when to stop. There's a saying when in our practical life. So in this case there's also saying that we should know that the body should know or should have the knowledge of regulation of the response. Then when should the inflammatory response or the process should stop. Then the repair, if there is injury to the normal tissues, then it should be repaired. It is in a most normal cases, in a most we should say in a most normal cases, if we want to understand the thing, that is residual, there's would be scarring also. And then we have already understood, already read the cardinal signs of the inflammation. Then there's the causes of inflammation. What are the causes? First of all, there are infections by some bacteria, virus, then fungal, parasitic, microbial toxins, which may cause inflammation. And the systemic reactions, I have underlined this. You can see that the systemic reactions can be fatal, severe systemic reactions that can be fatal and may cause chronic inflammation. Then we have the tissue necrosis. Tissue necrosis elicits inflammation. How if there's a trauma, ischemia, like that happens in myocardial infarction, thermal injury, and irradiation exposure to some environmental chemicals, the necrotic cells may release some molecules that will trigger inflammation, that will be injurious. That can be, we know that we can call them as injurious agent, which can be recognized by the body or recognized by the, what should I say here, stim okay, receptors and others. Okay, we'll study that when we will get mature. Then we will study the further advanced form and we can understand, I think. And then we have some foreign bodies, like that is splinters, dart, sutures. We know that when there's an operation and there may occur infection from the suture material, that is, it is foreign to the body, and it may cause the germs in the sutures, or they may cause traumatic tissue injury. Like the sutures may cause traumatic tissue injury, that is already tissue necrosis. We have read that tissue necrotic cells release some molecules that trigger the inflammatory process or inflammatory response. And here when foreign bodies like sutures can cause infection when when they carry microbes or germs, or when they cause traumatic tissue injury to the body, then inflammation can occur. Then we have these immune reactions. One thing, foreign bodies, in case of foreign bodies, there's also are uh, some endogenous substances that can be harmful if they deposit in tissues. Like, here there are some examples, like in gout, urate crystals are accumulated in the joints. Then atherosclerosis, cholesterol crystals are accumulated in the blood vessels, blocking the blood flow and blocking the vessels and causing many more ischemia and others. Then we have this lipids in obesity associated metabolic syndrome. Then we have this immune reactions. Immune reactions is that first immune reactions is that it's a hypersensitivity reactions. We can see it in autoimmune diseases, that we have allergies from environmental substances or against microbes. It can be the most dangerous, or should I say the most dangerous or harmful thing is that in case of autoimmune diseases, the environmental inflammatory stimuli for the inflammatory response, like the self antigens and environmental antigens, cannot be eliminated. So we can just, it cannot be cured. Autoimmune diseases cannot be cured, like is cannot be cured, not like that, it's difficult to cure and often associated with chronic inflammation. We know that. Immune reaction or autoimmune diseases can also cause inflammation.